Hello, this is Dr. Zahra, and today in this video I will give you some tricks which I use for my OSCE exam in the communication task as well as long case OSCE exam and OET speaking test. So the idea behind this video is to give you some tricks which can help you in your exam. Okay, so let's discuss some important lines, some magical lines you can use even in your real clinical situation. You can use this line. So let's start. Okay, so we already discussed last time that for your OSCE exam, even for your OET speaking exam, always start with the open-ended questions. So these line you can use for your open-ended questions, okay, and for your repo building as well. So for all of the communication tasks, make sure that the task should be started by the doctor, by yourself, not by the role player. Okay, so these are the lines you can use to introduce yourself and to greet the patient and to make the repo building. So let's start. On the side of this video you can see some of the lines. Let me take some recordings of this line, so I will put this recording on the side of my video. So let's start. Okay, so for the open-ended question and for repo building, these line you can use. Hello, my name is Dr. Khwaja. I understand you are here to discuss your recent test result. How are you feeling today? So by asking these question, by giving this line to the role player, you are encouraging the patient that to explore more about her today's feeling, and to make the to build up the repo building, and for open-ended is also very important line. So you can use this line, or you can use this line as well. I appreciate you coming in to see me today. I know waiting for results can be a stressful experience. So this line is showing that you have already read the case notes of the patient, and patient is here to discuss the results. So these lines are showing that you have already read the case notes, and you are making the Alright. Okay, so the third line is before we begin. Before we begin, you can see that in opening in the paragraph 1, you can see in the opening and repo building paragraph, the third line you can use. Before we begin, could you tell me a little bit about what has been on your mind regarding your health lately? So here you can use these lines. Even you can make your own lines, whatever comfortable for you. You can use this line, or you can you make your own lines. But the trick is you have to practice those lines in front of mirror daily for the good communication and for long case OSCE exam, and for speaking OET speaking exam. So these lines should be practiced by you every day in front of mirror, so you will be fluent in your exam on the exam day. All right, now for the history taking you can use. We all know how to take the history, we all know what are the important points in the history, but sometimes we stuck behind the sentence making. So by practicing these sentences will make you more fluent. So you can use open-ended question. Could you tell me more about that? Whatever the complaint given by the role player to you, so you have to explore and encouraging to the patient, to the role player, that she can give you more details. So whatever the information is with her, she will give you. So by using this line, you are exploring more about her or his complaint. Could you tell me more about that? And when exactly did you first notice the symptoms? When exactly did you first notice these symptoms? One important point I wanted to share with you, that for OET speaking sessions, you have to use the correct grammar, because there they are testing English grammar as well as tone as well as fluency. So make sure that you are correct on your grammar. But for your OSCE exam, or for your long case exam, it's okay if you haven't used the correct grammar, but the lines should be understandable by the role player, so she can give you the answers accordingly. So it should not be that much incorrect grammar that she will not understand your questions. But like if you are not speaking exactly the perfect 100 out of 100 grammar, it will be okay. So don't focus more on the grammar on your OSCE exams. But yes, for OET speaking test, it's important, if you are learning those lines, then learn those lines which is correctly formed. Okay, all right. So we were on the second line, and then third line is showing that to help me understand the full picture, or you can say that to help me understand the full problem, are you experiencing any other symptoms such as. So you can use more symptoms about the particular problem by using this line. Clarification is important. So it is very important for OET as well as for your OSCE, that you are asking for the clarification, whatever the symptoms are given by the role player to you. So you are asking the clarification. This is also one of the marks gaining point, that you are clarifying with the patient whatever the symptoms she is provided. So if for clarification, you can use this line just to clarify. You mentioned that you have symptoms I have written, so you can use whatever the symptoms are. So let's make the symptoms. So again I am telling this line to you. Just to clarify, you mentioned you have a heavy menstrual bleeding since 6 months. Is that correct? So with this line you are clarifying, and you are echoing as well. Echoing is one of the marks gaining point in OET speaking session. So this is very important, as well as in the communication task. It is very important to echoing and to clarifying your symptoms from the role player. For the past history, you can use this line. Have you had any similar issues in the past? Okay, the third is delivering difficult news. So there are sometimes breaking bad news. Even in the OET speaking and in the OSCE stations, there are some BBN stations in the communication task. So you can use this line. I am sorry to have to share this news with you, but the test results indicate that you have a type 2 diabetes mellitus, or you have a type 1 diabetes mellitus. So this is actually if you are telling some news which is first time for them, like diabetes, like cancer, some investigation which is showing the cancer and which needs biopsy. So here you can use this line for delivering your bad news, for delivering that particular investigation which you are thinking that it is not good for them, and they will be it's really difficult to when they will how they will react badly after hearing this news. So you can use this line, you can give the signposting to them by using this line. Second is, I understand this may be difficult to hear and I am here to support you. So I love this line. I love this line whenever you are saying in your real clinical setup that I am here to support you. This makes a huge difference in your patient care. In your patient will be more satisfied with you if you're using this line, if you making a practice to use this line, that I am here to support you. We as a team of doctor are here to support you. So this is, making your patient more confident on you, that you are really, supportive doctor. All right. And in the exam, of course, this will give you the marks. So you can use this line. I can see this has come as a shock to you. Please take your time. Or you can offer some, if there isn't sometimes they will provide you a tissue paper packet or glass of water, and they want you to use those. So you can offer them that, please have a glass of water, please take your time, please calm down. If you want, I can call you someone from your home. So these are some important lines you can use. See, the knowledge is very important to pass the exam. This lines will not make you to pass the exam. Of course, knowledge is very, very important, but these lines makes you more fluent in your exam. If you are practicing this line daily, so it will make you make your task more beautiful in the exam. So these are the lines. Okay. For counseling and explaining the management, you can use, I would like to explain why we recommend this approach. It is because, so for the management, if you wanted to, tell you more about the patient, that this is very important, why you wanted to prescribe this medication, how it will help you. And then the next line, based on the international medical standard, the recommended course of action is, and the third line is saying, we call this condition, which essentially means that your body is having difficulty with, so any condition, whatever the condition is, and you can describe that condition. This is also one of the mandatory tasks in the OET speaking session. Whenever they are giving some consultation kind of task, then they want you to describe that condition. For example, I remember that in my OET speaking session, it was a herpes zoster, and there was a one task to describe that condition of the patient. Patient want you to know more about that condition. So this is very important to explain the condition, as well as in the communication task. Patient wants explanation about their particular complaint or whatever the condition. For example, the patient is having a fibroid or whatever the condition is, you have to describe what exactly the problem is. Okay. So you have to describe the condition in the layman language, not in the medical language. Okay. The main priority for your long-term health is to prevent potential complications such as, so if you wanted to give more information about the complications, then you can use this line. Checking understanding. The fifth important point is, always make sure whenever you are giving some information to the patient, always make sure to check understanding. Don't give a full paragraph to the patient and without giving any stop in your speaking. Always make sure, if you are giving some information, make sure to pause in between 2 to 3 minutes if you have completed your task, and if you have given the information, and then ask for the understanding. And how to ask? You can ask that if you are giving the management, for example, if you have given some management plan to the patient, now you can ask, does this explanation make sense so far? You can use this line as well. I have covered quite a bit of information. What are your thoughts on this? Before we move on to the next step, do you have any questions what we have discussed? So this is how you are checking understanding. This is also one of the marks gaining point in the communication and the OET speaking session task. Closing and negotiating a plan. So these are the line you can use. How do you feel about this management plan? I appreciate your concern. I will prepare the necessary referrals for you today. If you thinking that one of the tasks is to give referral, or then you can use this line. I would like to see you again in 2 weeks to monitor how you are responding to these changes. Does that time work for you? Is there anything else worrying you that we haven't covered today? This is the most important line. In the end, you can see this is the most important line to ask from the patient. Might be there are something which you have missed after data gathering, after management, and might be some concerns which in their mind they wanted to discuss with you. With the role player, there are some information, some information they are giving, so might be some information you have missed. So when you will ask these questions, they will give you if some information missed by you. So this is very important to use in every communication task. This line, is there anything else worrying you that we haven't covered today? So whatever missed by you, they will tell you. Okay, pause is very important. Don't keep on speaking. Always give some pause, and after you delivering information, wait for 2 to 3 seconds to make the role player, allow the role player to to listen and to give you more information. So the pauses are very important. If you are giving the information, just or in that pause you can use this line for the understanding. Is it okay for you so far? How does that sound for you? Okay, and this is a vital part of active listening. Empathy is very important. Instead of just saying that I understand, okay, you can say that I can imagine how frustrating that must be. So these lines showing some empathy, active empathy in this lines you can see. It's completely natural to feel concerned about that. So these are some important line for active empathy. Signposting is also one of the important tasks in the speaking session. So if you wanted to move from one, if you have already discussed the data gathering, now you wanted to move towards the treatment part, so you can use this signposting that now I would like to move on to discuss the treatment option for this problem. Finally, I would like to summarize our plan. So in the end, I have written that using these phrases consistently will make your consultation sound organized and deep, patient-centered. And this is actually the communication task they wanted from you, and they wanted the sympathy, empathy from towards the patient. They wanted echoing, they wanted clarification, they wanted checking of understanding. So they wanted active listening. So these are all the lines which surely help you in your exam. You can use this line, you can make your own as well, but practicing these lines or practicing your own lines daily is very important. All right, so hope this video is useful for you, and thank you. Bye.